Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, welcome to the new topic of fundamentals of medical laboratory technology. Today our lecture will be about the essentials, the important terminologies and the basic parts of pathology. In today's outlines we will discuss about the introduction of pathology, about the basic terminologies and what is pathology and what we learn and what we discuss in the pathology. Then we will discuss about the important medical terminologies which are used in the sense of pathology. What are the different medical terms which are used in the pathology department. Then at the end we will discuss about the different types of cellular adaptation as a result of changes in the cellular environment and the different phenomena that leads to changes in the cellular environment. Coming to the introduction of pathology. So, pathology is basically the combination of two words, one is pathos and the other is the logos. The logos is the studies and the pathos means the disease or the suffering or the disturbance. So, pathology is basically the study of diseases, which is these diseases may be caused by any sort of any physical or chemical or any type of disease, and they disturbs the normal structures and functions of the human. So, in the pathology we will discuss about the diseases and what are the different causes of disease, how the disease develops, what is the agent which have caused the disease, what is the phenomena which ends in the disease development, and then we will pathology the associated changes at the levels of the cells. What are the different changes that occurs within the cell when the person or the host develops a disease, how the cell responds to the disease, and what are the different chemical reactions that are changed or that are slowed down or that are fast in reaction, or certain new phenomena or certain new functions that develops within the cell. So, in pathology we discuss about the changes at the cellular level of the person, that what are the different changes that develops that occurs within the cell, and then we also discuss about the changes in the tissue, that how a tissue it reacts to the different types of disease, if there is any chemical injury and then disease develops in response to that injury, or if there is any physical or mechanical damage, then how the tissue overall reacts to this change, or if any other sort of disease and how the tissue responds to that sort of disease. So, all these are discussed in pathology, and the different organs that reacts in response to the different types of disease. For example, in case of hepatitis, so the liver is damaged in this sort of disease. So, we discuss that how the organs react to this disease and what are the different changes that occurred within the organ and how the organ then survive and then it performs its normal functions and maintains its structure during the disease condition. So, all of these are discussed in the pathology, and also the overall changes within the cells, within the tissue, within the organs, which give rise to the presenting sign and symptom of the disease. That during the condition of disease, the changes in the cell, the changes in the tissue, and the changes in the organs. These all are presented in the form of signs and in the form of symptoms, that how the patients feel during the disease condition and what are the changes that is caused the patient to change its normal routine schedule, and how the patient then reacts to their changes within the body, within the tissue. So, all are these are studied in the pathology. Then the different medical terminologies which are important in the case of pathology and the related different fields. So, in the pathology, first we discuss what is the disease, and then the etiology, the pathogenesis, the diagnosis, the clinical manifestations, the prognosis, and epidemiology. So, all are these are the important terminologies which we will discussed in this lecture. And coming to the first terminology, that is the disease. Disease is basically the abnormality of the normal structure or functions of the body, that if there is any disease in the body and that disease is the abnormality of the normal structure or functions of the body or part of the body along with sign and symptoms. For example, if a person is having a malarial infection, and so basically this malaria is a disease condition and this is an infectious condition. So, the body structure or the functions of the blood that are abnormal, and the structure of the liver that is also slightly abnormal, and due to that abnormal structure and functions of the blood and the liver, then certain sign symptoms appear, and this condition is called disease. Or in another case, if we consider any other disease, for example, there is a poliomyelitis. The polio have damaged the nerves of a patient, and due to that damage the patient cannot walk, and their nerves which is supplied to the different organs, the different parts of the body, so their body parts do not work, and there is abnormality in the structure as well as in the functions of the person. So, that condition is a disease. Then the second term is the idiopathic. Idiopathic is basically a type of disease. That what is idiopathic disease? Idiopathic disease, that type of disease in which the cause of the disease is not identifiable, and we cannot say that this disease is caused by this agent or this mechanical injury or this chemical substance or this agent. So, this type of disease is called idiopathic disease. For example, certain diseases that are newly emerged and they are recently discovered. So, the agent or the causing pathogen of this disease is not known. So, that sort of disease is called idiopathic disease. Iatrogenic disease is another type of disease, and this disease occurs as a result of medical treatment. For example, if a person comes to the hospital and during hospital treatment, after the treatment he develops another type of disease. So, that type of disease is called iatrogenic disease. Example of this is the reaction of any drugs or any pharmacological agent on a person's. So, if a person develops any sort of sign symptoms, any sort of disease condition after the intake of that medicine, after intake of the drug, and that person develops certain sign symptoms, so that sort of disease is called iatrogenic disease. The third type of disease is the congenital disease. This is a type of disease which exists at the time of the birth of the baby or even before the birth and during the development of the fetus. So, this type of disease is called congenital disease. For example, if there is any type of mutation in the DNA or if there is any sort of change in the fetal development. So, and that change leads to disease. So, when the baby is born, so at the time of birth that baby already have disease at the time of birth. So, this type of disease is called congenital disease, and acquired disease is that type of disease which develops after birth. So, all the diseases which develops after birth, that disease is called the acquired disease. Nosocomial disease or nosocomial infection is another type of infection. This disease develops as a result of the hospital environment. For example, if a person is injured and that is taken to the hospital, so during the hospital stay he develops an infection or he develops another disease due to that environment of the hospital. So, that type of disease is called a nosocomial disease. Diagnosis. Diagnosis is the process for finding out the agent or to identify the possible disease or disorders. That, for example, if a person is diseased and he had certain sign symptoms and that comes to the clinic and doctors tries to find out the possible cause of the disease and to find out what have happened to this person. So, this all the phenomena that are required to finding out the possible disease. So, this type of process is called diagnosis. Prognosis is related to the diagnosis and it refers to the expected outcome of the disease, that what will be the end result of the disease, how the patient will be at the end of the disease. That for example, initially there is if there is infectious disease. So, first the agents that enters into the disease and that goes to the specific site where it reproduces itself, and after reproduction sign and symptoms develop, and then after the development the doctors, the staff tries to find out the diagnosis, and after diagnosis then there is a stage of treatment. So, at the end of the treatment, what will be the result of the treatment? If the treatment works, so that person will be recovered from the disease. So, this is called the good prognosis, and if the person do not recover from the disease, this type of prognosis is the bad prognosis. So, prognosis is basically the expected outcome of a disease. Complication, it is the start of the disease in a person who is already coping with another existing disease. So, if a conditions develops secondary to a condition is, so that type of disease is called complication. For example, a person is having a diabetes mellitus, and as a result of the diabetes mellitus the kidneys are damaged or the eyesight are damaged. So, these disease develops as a result of this diabetes mellitus or this hyperglycemia. So, these are called the complication of the disease or the complication of this diabetes mellitus. So, this is the example of complication. Sequelae is a result in unwanted outcome of a disease or the result of the trauma. For example, if a person is having any sort of disease, and as a result of the disease if any organ is removed or if there is a permanent disability occurs due to disease. So, this type of condition, this type of unwanted result of the disease is called sequelae. Clinical manifestations, these are the sign and symptom or the evidence of a disease, that if a person develops a disease, so as a result of their disease there must be clinical manifestations, there must be sign and symptoms of disease. So, these are the evidence of a disease. And sign is the change that can be observed or measured by another person, for example the pulse rate, the blood pressure, the temperature. So, these are the signs of a disease, that if someone else he can observe or he can measure the changes, so that type of changes are called signs. And symptoms are the experiences that are being reported by the persons or the complaints, for example the pain, the nausea, the vomiting. So, these are the symptoms of the disease. Biopsy is the removal of tissue from the living body for diagnostic purpose. So, this is called biopsy. And if there is a autopsy is another terminology which is related to biopsy. So, removal of a tissue from the dead body for any diagnostic purpose, so that is called autopsy. Cytology is the study of the individual cell. So, this is called cytology. Cyto means cell and logy is the study of the cell. Etiology, it is the study of the origin of the disease, including the cause and modifying factors. So, etiology is basically from where the disease develops, what is the cause of disease and what are the factors that leads to this disease. So, this term is used for the origin and the cause of the disease. And pathogenesis is the term used for the developmental stages of disease, how disease developed, what are the different phenomena that end up in the development of the disease. Etiology refers to why a disease developed, and pathogenesis describe how a disease developed. So, etiology why and pathogenesis how. So, these are the terminologies that are required for the development and for the disease and for pathology. Morphologic changes are the structural changes in the cells or any part of the body that can be seen by the eye. So, these are called the morphologic changes. And clinical significance is the consequences of the morphological changes and the disease. So, the importance of the morphologic changes, that is the clinical significance. Now, the different prefixes and the different suffixes and roots which are being used for naming any disease, for naming any phenomena in the medical field or in the pathology. So, root is the foundation, the base of the word, and prefix the place before the root to modify its meaning. So, prefix is used to modify the meaning of the root, and suffix also it is placed after the root to modify and give essential meaning to the root. So, root is the basic word, and prefix and suffix, these prefix is used before the root and suffix is used after the root. So, these prefix and suffixes are used to understand and give important meaning to the root. For example, this is a term hyperlipoproteinemia. So, here the prefix is hyper and it means higher, and the root is lipoprotein, this is the root, and the suffix is emia. Emia means blood. So, this means that there is a hyper, lipo is taken from the lipids and protein is protein, and emia means blood. This means the increase the lipids and proteins in the blood. So, this is how a term is used to modify. The prefixes and suffixes are used to modify any word and to give the name of the condition. Another example of the prefix and suffix, so it is the hepatosplenomegaly. Here the root is the hepato and it stands for the liver, where spleno stands for the spleen and megaly means enlargement. So, the hepato and spleno, both of these are the roots, and this is only the suffix which is attached to this root. So, this suffix gives the meaning that there is an enlargement of the liver and enlargement of the spleen. Another condition is the meningitis. Here the meninge is taken from the meninges, and these are the layers of the brain, and suffix is the itis, and this means the inflammation. So, this is the inflammation of the meninges layer of the brain. So, this is the condition which is being modified, and it is named by addition of suffix to this meninges. Another term also that is modified by using a prefix. Here the root is cardia, and cardia is taken from the heart, and prefix means prefix is the tachy, and each means rapid and fast. So, this means tachy means fast and cardia means heart. This means there is increased heart rate, increased heartbeat. So, these are the conditions, and these prefixes and suffixes and roots are used in the different medical terminologies to name the different conditions. Now, let us discuss the different cellular adaptation. So, the cellular adaptation, it is defined as the adjustment of cell within the limits of the changed environment to preserve the viability of the cell. So, cellular adaptation is basically the adaptation, the changes of the cellular environment according to the changes conditions within the body, within the tissue or within the organ. So, this type of changes is called the cellular adaptation. For example, if there is any injury in the cell, of is there any deficiency in the nutrients, deficiency in the blood, or deficiency in the other requirements of the cell. So, during that tough condition, that deficient condition, the cells adjust itself, its condition, its reactions, all its functions according to that changed environment. So, that type of changes within the cell is called the cellular adaptation, and these adaptation may be physiological and these may also be pathological. So, the physiological adaptation are all the responses of the cell to normal stimulation by the hormones or by the different types of indigenous chemical mediators. For example, the hormone induced enlargement of the breast and uterus during pregnancy. So, if there is any changes in the body according to the requirement of the body, and their changes is stimulated by the hormones or the different chemicals. So, that type of adaptation, that type of changes, that is called the physiologic adaptation, and that is the need of the body. For example, if there is different types of hormones and that are released by the body at the age of puberty, different hormones are released to induce the development of the breast, and also during pregnancy different hormones are released to enlarge the uterus. so that the fetus may be well developed and to prepare a good environment for the zygote. So, this type of adaptation is called the physiologic adaptation. The pathologic adaptation or changes, these are the adaptation, these are the response to the stress that allow cells how to modify their structures and their functions to avoid any type of cell injury or any type of cell death. So, that type of adaptation is called the physiologic adaptation. There are different types of cellular adaptation. The first of them is the hypertrophy. As we have discussed in the previous slides that the terminologies. So, hyper means increase and trophy is the size. So, increase in the size of the cells resulting in increase in the size of the organ, this condition is called hypertrophy. So, for example, if an organ that have 100 cells, so if all the cells they increases their size, the number of cells remain the same, but the size of the cell increases. So, all cell if they increase their size, so overall the size of the organ will be increased, and this type of condition is called the hypertrophy. In hypertrophy, the new cells are not produced, but only the amount and the proteins and the organelles of the cells they are increased. So, this is actually happens within the hypertrophy, and the example of the hypertrophy is that the physiologic enlargement of the uterus during pregnancy as a result of the hormone estrogen. So, during pregnancy this estrogen is released and this causes the enlargement of the uterus. So, this is the example of physiologic hypertrophy. And the pathologic hypertrophy, cellular hypertrophy in case of the cardiac enlargement that occur as a result of hypertension or if there is any aortic valve disease. So, the cardiomegaly occurs. Cardiomegaly is basically the enlargement of the heart. So, this is the pathologic example of the hypertrophy. Another conditions that is the hyperplasia. Hyperplasia is the increase in the number of cells that results in increase in the size of the organ. So, this is called the hyperplasia. Hypertrophy and hyperplasia, these are the related terms, and in hyperplasia only the number of the cells increases, the size of the cells remain the same, and this hyperplasia may occur along with the hypertrophy in response to the same stimuli. Sometime if there is a stimulus, so that stimulus also results in the hypertrophy as well as the hyperplasia. So, sometime both of them occurs combinedly. So, the hyperplasia and hypertrophy occurs at the same time. So, the hyperplasia may be pathologic or physiologic. So, in case the proliferation of the glandular epithelium of the female breast at puberty during pregnancy and during pregnancy. So, this type of hyperplasia is the result of the physiologic release of the chemicals or the hormones, and pathologic hyperplasia is caused by the excessive hormonal or growth factor stimulation. If there is excessive hormone is released or excessive growth factor hormone is released, and that results in the increase in the number of cells of the tissue. So, this is the hyperplasia. Atrophy is the another type of cellular adaptation, and this atrophy, it means the shrinkage of the size of the cell due to loss of the cellular substance. So, this is called atrophy. If the organelles or the proteins of the cell they are decreased. So, due to that organelles decrease or the components of the cell there decrease, the overall size of the cell is decreased and that ends up in the shrinkage of the tissue. So, this condition is called atrophy. And the mechanism of the atrophy, it consists of combination of decreased protein synthesis and or increased protein degeneration or increased protein degradation by the cells. So, if there is low protein synthesis and high protein consumption, high protein degradation, and this mechanism results in the atrophy. The atrophy may also be as a result of increased workload or loss of innervation. Decreased workload as a loss of innervation. If there is nerve damage and there is decreased workload, so the atrophy can be occurred, and if there is a diminished or decreased blood supply, so they also results in atrophy. If there is improper or inadequate nutrition, that results in atrophy, or if there is any loss of endocrine stimulation, if there is no hormonal stimulation or aging. So, all these conditions they leads to the atrophy. Metaplasia is another type of cellular adaptation, and this is basically a reversible change in one adult cell type and is replaced by another adult cell type. For example, if there is any change in the cellular type and this change is that cell type is replaced by another cell type. So, when the stimuli is removed, then the cellular type that comes to its original condition. So, this type of condition is called metaplasia. In metaplasia, a cell type sensitive to a particular stress, to a particular phenomena, to a particular stimuli is replaced by another cell type which have better ability to survive in that adverse environment. And the example of this metaplasia is that the normal ciliated columnar epithelium cells of the trachea and bronchi, they are focally and widely replaced by the another cell type which is the stratified squamous epithelial cells. So, this stratified squamous epithelial cells, they survive in case in this area of the trachea because of the stimulus or excessive smoke or the dust particles or the stimuli. So, therefore, when the stimuli is removed, these normal ciliated columnar, they again replace the stratified squamous epithelial cells. Cell injury, it is a set of biochemical morphological changes that occur when the state of homeostasis is disturbed by a persistent and harmful stimuli, or when the adaptive capability of the cell is exceeded by a harmful and persistent stimuli. So, this type of condition then leads to a cell injury. And the third type of definition is when the limits of adaptive responses are exceeded and cell injury occurs. The cell injury may be of the reversible type and the irreversible type.